My friends, may I present to you Mr. and Mrs. Patrick Donald. Congratulations.
I married my husband Patrick on an Indian summer day, surrounded by our big Catholic families. On my side alone, there are 14 nieces and nephews, and I always assumed I would add to that count in spades. A year after the wedding, Pat and I decided it was time to start a family. I triumphantly saved the news for Father's Day, leaving one of those dime store ribbons near his glass. Number 1 dad.
And here we see this little flicker heartbeat.
That's so awesome.
5 weeks later, I started to bleed. In the emergency room, the doctor told us there was nothing he could do. I was 35. We could try again. And we did. I got pregnant fairly quickly. This time I made it 8 weeks. But again, I miscarried. And again, and again, and again, and again, and again. 7 miscarriages in all. And I am not alone.
I've had 2 miscarriages.
There was no heartbeat. I lost my first baby at 13 weeks.
11 weeks.
I thought that maybe I would never be a mother, and I think that was the hardest aspect of it.
Doctors say 1 in 4 pregnancies end in miscarriage. For women over 40, that rate jumps to 50%. More than half of all losses are due to chromosomal abnormalities, a misstep in the dance between sperm and egg, as the biological clock keeps thunderously ticking.
A 25-year-old, when she ovulates, 14% of the time, that egg is chromosomally abnormal. By the time you're 38 years of age, 60% of the eggs are abnormal. By the time you're 40, it's 70%.
Dr. Joseph Hill runs a fertility clinic west of Boston. A former Harvard Medical School professor spent 20 years researching causes of miscarriage and treatments, but says he left academic medicine out of frustration.
In terms of research, how far have we come in the last 10 years?
In my opinion, sadly, we haven't come that far.
The National Institutes of Health ranks what it considers the 200 conditions most important to public health. Miscarriage is not among them. Research on treatments and potential cures receives just 0.03% of the U.S. government's $31 billion pie.
More research is being done on trying to understand why thoroughbred racehorses have miscarriages than people.
Doctors say the lack of public funding is in part a product of the population, women often suffering in silence. When I was going through my miscarriages, people came out of the woodwork to tell me about their own, their mothers, their wives, their sisters. But they talked in hushed tones, reinforcing the feelings of secrecy and shame. I said cheery things to make them, or maybe me, more comfortable, but I was crumbling into a debilitating depression.
In some sense, you feel like a failure, because we're women, right? Lots of things we may be able to do, but the one essential thing we're supposed to be able to do is have children.
After the preterm birth of her daughter 12 years ago, Darcy Klein lost 4 pregnancies. The first at 13 weeks, the next at 8, then twins at 20 weeks. Swollen with her unborn children, Klein still had to go through labor.
Which it's very hard to push your child out when you know that there's just no place for them in the world, right?
Klein grieved, but then she got angry. She demanded a more rigorous medical workup and was eventually diagnosed with 2 very treatable disorders. Klein went on to have a son, proof positive, she says, that some doctors are too quick to dismiss a miscarriage as nature's way of saying the pregnancy wasn't right.
We're focused on this part that we can't do anything about when there's just as big a part that we can, but we're taking no action to do so.
Testing is not enough for everyone.
It is like finding the needle in the haystack.
Dr. Rachel Ashby is a reproductive endocrinologist at Boston's Brigham and Women's Hospital. She is also my doctor. And though my last miscarriage was more than 2 years ago, my emotions remain raw.
Sorry. Where we are today in medicine, why couldn't you find a reason?
All of your testing, all of the medical workup for recurrent pregnancy loss was essentially negative.
So far, there have never been answers for me. But Ashby says the future for women suffering recurrent loss is likely something called pre-genetic screening.
To determine before you are pregnant which embryo has the highest chance of making a healthy baby.
Of course, there's a catch. That best embryo has to be implanted through in vitro fertilization, an expensive treatment often not fully covered by health insurance.
For many couples, financially, it won't be realistic, and that is a heartbreaking possibility.
But Ashby says there is still hope, even for women with recurrent loss. Statistics show that if they have it in them to keep trying, there's a 60 to 80% chance they will go on to deliver a healthy baby.
Come here, come walk to me.
On December 8th, 2008,
You're walking!
Isabella Mae Donnelly was born, my daughter. I didn't use IVF or donor egg or a surrogate. I guess I finally got lucky. But advocates say families shouldn't have to be so dependent on luck.
This is where breast cancer was 25 years ago. And now it's out there, it's open. But they started from a place where it wasn't even whispered about. And that's where we're at right now. We have to stop whispering and start shouting.
I am shouting, but still, I wonder what will happen if I get pregnant again, and if I can bear it. But then I remember, I can. Allie Donnelly, NECN.